well, this would be of great help to our society. So thank you very much for your efforts.
Thank you. Next presenter.
I want to thank Senators Padilla and Alquist for your leadership, and I'm pleased to help us to also bring oral health into the discussion. As my PowerPoint's coming up, I'm Stephen Levy from the University of Iowa College of Dentistry and College of Public Health, where I'm a professor. Dental caries is a disease from the very complex interactions between the acid-producing bacteria and the fermentable carbohydrates in our diet that results in demineralization of tooth structure, which results in cavities or dental caries. And it really is quite a balancing act because we have microscopic cavities forming on our teeth all the time, but it depends on our risk factors, and one of those is the dietary factors dietary factors is a major factor. There were 4 classic studies done 30 to 40 years ago that are listed here that helped us to understand about how important sugar consumption is, being positively associated with dental caries, and especially when we had that consumption with and between meals. We had very substantial increases in cavities, whereas it was somewhat smaller when the sugar was only with meals. And there's also evidence that when the sugar exposure is reduced, then dental caries is reduced. And if you didn't have exposure for a long time and then get increased exposure, you get increased rates of decay. So there's a long history of understanding this. But we now realize that the soda pop is a big part of it as well for many reasons due to changes in behavior. And I'm going to briefly mention a couple of our articles and 3 others from the literature to help us understand this. We've been conducting a study called the Iowa Fluoride Study, where a cohort has been followed from birth, and using 3-day food and beverage diary data from birth to age 5 and linking that to dental caries experience, meaning any cavitated or filled lesions at age 5 dental exam, and conducting logistic regression analyses, we're looking at those associations. In this paper, meals and snacks were not separated, however. And here you can see in red a couple of the key findings. During these early years, there already is harm from this intake. In the 2nd year of life, there was a doubling from those who had sugared soda pop versus those who didn't in the percentage with dental decay. In the 3rd year, also a doubling. And when we went ahead and looked at the 5th year, we again get about a doubling for the higher intake group of sugared soda pop. And when we combine that intake over the 5 years of life, also more than doubling for that group that had the higher intake. We then went on to actually break down extracted information from the meal and snack more separately. And it's the same basic core study, but the quantities and occasions were separated out for meals versus snacks from the diaries, the same kind of outcome variable, and we